Welcome back to my channel. My name is Jocelyn, and for today's topic, I'm going to discuss the latest U.S. travel restrictions. If you are a non-U.S. citizen, here are the current travel requirements. If you are a non-U.S. citizen, you must be fully vaccinated. However, there are exemptions. Children below 18 do not need to be vaccinated. Also, if you are covered by specific exemptions. For non-US citizens, you must be fully vaccinated and you must have one-day negative test for 2 years old and above, or you must be fully vaccinated and must present proof of recovery within 90 days of flying. You must present letter and proof of COVID infection. In this video, I'm going to focus on the proof of recovery from COVID within 90 days of flying. Here are the requirements. Proof of recovery within 90 days of flying can be presented. People who have recovered from COVID-19 can continue to test positive for up to 3 months after infection. CDC does not recommend retesting within 3 months after a person with COVID-19 first develops symptoms of COVID-19. If you have had a positive viral test on a sample taken during the past 90 days and you have met the criteria to travel, you may travel instead with your positive viral test results and a signed letter from a licensed healthcare provider or a public health official that states you have been cleared for travels. The positive test result and letter together are referred to as document of recovery. Here are the specific requirements. First, a letter from your healthcare provider or a public health official that clears you to travel must have information that identifies you personally that matches the personal identifiers on your passport or travel documents, and the letter must be signed and dated on official letterhead that contains the name and address and phone number of the healthcare provider or public health official who signed the letter. If you recovered from COVID but you were not able to present documentation of recovery, you will need to have COVID-19 viral test result from a sample taken no more than 1 day before your flight to the U.S. departs. For non-U.S. citizens and non-immigrants, here are the covered exceptions. That individuals are persons on diplomatic or official foreign government travel. Also, children under 18 years of age. Also, persons with medical contraindications to COVID-19 vaccine. In addition, participants in certain COVID-19 vaccine trials, persons issued a humanitarian or emergency exception, also persons with valid visas except B1, B2 who are citizens of foreign country with limited COVID-19 vaccination. Also members of the U.S. Armed Forces or their spouse or children under 18 years of age. In addition, sea crew members traveling with a C1 and D non-immigrant visa, and persons whose entry would be in the national interest as determined by the Secretary of State or Secretary of Transportation. Now, if you fall under any of these exceptions, you will be required to attest that you are exempted from the requirement to present proof of being fully vaccinated against COVID-19. As a requirement, you will be tested with a viral test 3 to 5 days after arrival, and you will also self-quarantine for a full 7 days, and you will also self-isolate if you test positive. Even if you're exempted but you plan to stay in the U.S. for more than 60 days, you will have to attest that you will arrange to become fully vaccinated within 60 days of arriving in the U.S. or when medically appropriate unless you are too young. If you have any other questions or comments, please post them down below and I will get back to you as soon as I can. Thank you guys for supporting my channel, and if you haven't liked this video, please give it a big thumbs up. And if you haven't subscribed to my channel, please subscribe and hit that notification bell. I always welcome new subscribers. Thank you guys for watching. I hope everyone is staying safe and have a great day.